Hey baby girl, welcome back to my channel. It's Carla Toledo once again with another vlog. And today I'm going to be talking about my experience on passing my clinical board exam on the first try, finding my dental board patient, tips and tricks, and so much more. So stay tuned for the video. As you know, I live in Massachusetts, so I took the CDCA ADEX examination. Anything I talk about in this video will be in regards to that board exam. Baby girl, out of the 5 board exams that I took, this was the one that I was like, Lord, please don't let me fail this one, because it was so hard finding a patient and having to rely on another human. So if I had to pick, this was the one that I was like, I really don't want to fail this one. I don't want to retake this exam. I created a flyer that I posted on Craigslist and I used to hand out to people. This is what I wrote on the flyer. Looking for a board patient with a negative medical history, non-smoker, last cleaning within a year. You will be compensated for your time and receive a free dental cleaning. I started my screening at my church. I started looking for board patients there, and unfortunately a lot of them didn't qualify. They had extensive medical histories, missing teeth, active decay, so only one of them was a potential candidate. The one patient from the church that I was able to screen had rings of calculus. The calculus was so much that it was showing on the radiographs, so I was so nervous on using that patient. The calculus had glass-like appearance, so I knew that it was going to be tenacious calculus, hard to remove during the board exam. But because I was running out of time, I asked him to be my board patient. I didn't feel like he was the right patient, so I didn't stop looking. I kept, giving out flyers, posting things on Craigslist and stuff like that. One day I was passing flyers out in the clinic and a young lady approached me and she said, I'm willing to be your board patient, if you pay me. And I was like, baby girl, cha-ching, I got the money for you. Don't worry about that. Now, the problem that I encounter is that my clinic had closed the screening clinic days, so I couldn't screen my patient anymore. The week before the board exam, I remember going to my mentor and asking her, please open clinic one more day. I need to screen one more patient. And she was like, Carla, I thought you had your board patient already. And I'm like, yes, but he is too hard. I see a lot of calculus and I don't feel confident seeing him. And he told me he's never had a cleaning in his life. So, red flag. My mentor spoke with the clinical instructors and said, hey, one of the students needs to have one more day to do a screening. They asked who it was. And she said, it's Carla. One of the instructors said, Carla, I'm not worried about her. That girl can scale. Because my mentor had told her that I didn't feel confident doing the cleaning on that patient. However, bless the Lord, my mentor went to the chairperson and explained the situation. And I think I wasn't the only one that needed to screen more patients. So they opened the clinic one more day. This was like a week before the board exam, guys. I was freaking out. If you don't feel confident using a patient, whether he has too much calculus or not enough calculus, or you can't really feel, if you're not confident, don't use that person or have them as a backup. And keep screening more people. Keep on searching and trust your gut feeling. This patient had a medical history that was negative, non-smoker, last cleaning within a year ago. I felt like she fell from the heavens just for me. I mean, this was like a week before the board exam, so I felt like, yes, she's the one. I found my board patient. Just so you know, you're not allowed to scale a patient before the board exams to see if the calculus is going to be hard to remove. But clinically, a hygienist knows when she knows. And I knew as soon as I put that Cavitron, that calculus was going to go flying everywhere. I was so happy, baby girl. So I'm exploring here and there and I'm thinking, whoo, calculus here, calculus there. But beware, make sure you have diagnostic radiographs up and running, because a lot of the times I thought it was calculus.
It was an overhang. It was like a restoration.
Tip for you, make sure that when you're screening, when you're exploring, that you're feeling calculus and not an overhang or a restoration. Have your x-rays up, make sure you're blowing air. So for my patient, I decided to pick the lower right quadrant and a couple of teeth on the lower left. If possible, pick the lower arch. The maxilla is harder to clean. The posterior molars have 3 roots You have to use a lot of indirect vision. The patient is like, The Exorcist, you know, tilted back like that. So if you're able to stick with the lowers, plus baby girl, lower anteriors tend to build a lot of calculus. So that's a lot of lingual surfaces that you're gonna be able to clean up easily. Prior to the board examination, make sure that you have 2 kits prepared, nice and sharpened. In case one instrument falls, then you already have your next kit ready to go. Especially me, I was so clumsy, and buy a couple of new instruments that you're gonna leave for the day of your examination, like, you know, extra sickles or whatever your favorite instrument is. For the day of the board exams, I told my patient, hey, I can go pick you up. And she was like, oh no, that's fine. I live 15 minutes away from here. I'll drive there. And I was like, yeah, but I'd rather escort you, make sure you don't get lost on the way. So she let me do that. Baby girl, let me tell you, I went to pick her up like an hour early. She was behind me and I kept looking at the rear view mirror like, is she still there? Like, I was so nervous. She probably thought I was a psycho. You do whatever you gotta do to feel comfortable and not as anxious for your board exam. When you get all your forms and paperwork, don't get stressed because you're gonna have an orientation to go over that, and your instructors are gonna be there to help you. Just make sure that you read all the packets that they give you. For the day of the boards, I didn't have to go to a testing site. The examiners came to our school. They were stationed in clinic 2 and we were seeing our patients in clinic 1. So at least I had my Cavitron there, all my instruments. It was a comfortable place because I knew where everything was. The big day is here. I took my patient's blood pressure. I reviewed the medical history. She signed some forms, and then we sent her to the examiners. She came back with another form that had 2 teeth that I needed to probe, an anterior tooth and a posterior tooth. Also 3 extra teeth that I had to do calculus detection on. The exam lasted 2 hours, which I think is plenty of time to clean the lower arch, and you're not even cleaning the whole lower arch. Just think of it as another day in the clinic, you know what I'm saying? You got this. There was a dentist on site who anesthetized my patient on the lower right with a IA, and on the left side, we were able to use like topical. You wanna make sure that your patient is as comfortable as possible during this procedure so that you're able to remove all that calculus. Try to keep the gums as intact as possible because the examiners will take points away for tissue trauma. If you cut off somebody's gum and you see the papilla flapping in the air, it's better to cut it off completely than to leave it like flapping because, like I said, they're gonna take points away for that. I used my Cavitron, I hand scaled, I polished my patient's teeth, I flossed all the contacts to make sure there wasn't anything stuck there, and I thought my patient looked pretty good. I was like, oh my goodness, I did the whole cleaning. But ding ding ding, another tip for you, baby girl, make sure you're using the air water syringe and blast that air like everywhere, because when you do that, it dries the calculus and it gives it a chalky appearance so that you can see it better. I thought my patient was clean, but when I blew that air, I was like, what is this? I'm like, where did you come from? Like, yeah, I found calculus still remaining on some of the teeth, so I went back. Remember, the examiners are gonna do the same thing. They're gonna be using their explorers, they're gonna be using their air, so be a step ahead of the game and do that. I think after like an hour and 45 minutes, I sent my patient back to the examiners, and I was so nervous, but I felt like I had done everything. My patient looked good, you know, I explored. So I'm like, okay, it's time to send you over there. Patient came back, you know, the appointment was over. We went outside and I was like, oh my goodness, tell me, what did they say? Did they have a facial expression where they're like looking at each other like, what happened? And she said, no, just 3 different people checked me, but they didn't really say anything. They were writing things down. And I was like, why was this girl not paying attention? Like, I wanted to know what they said. Then, you know, I dismissed my patient. I paid her money for the time that she took being there for me. You know, I appreciated that. And I told her, I'll see you next week to finish the rest of your mouth. I didn't feel confident, but you're gonna learn one thing in hygiene school. Anytime you take a test, you're never gonna feel confident. So FYI. Within 10 days, I received my results. I was freaking out, but it said pass. And I'm sure it's gonna be the same for you. Just kind of follow these tips, okay? And you're gonna be fine. It's not it's not like you haven't cleaned teeth before. So just feel confident, baby girl. As long as you have the right patient, you're gonna be fine. I'm gonna close. That is it for today's vlog, and I hope you find this helpful. Please comment, subscribe, let me know anything that you want me to talk about, and I'll make it happen. Bye.